I think I would like to improve health equity, especially post-disaster, in terms of like health access post-disaster.
I want to just attribute to communities that are in need, provide them the resources that they ask for and answer questions.
I'm really interested in studying the disparities in public health and figuring out with health literacy how I can really help people for health to be more accessible.
I mostly focus on nutrition, so really focusing on nutrition guidance and the way that we translate science in nutrition. I think for the past few years it's been very one sort of modality, sort of paradigm, and I really want to start the conversation in order to shift that.
Ooh, that is a really good question. I think for me, my main goal is just to increase equity, especially for our Black and brown communities. In my hometown, Prince George's County, I really just want to make sure that the county that I'm living in, I'm able to contribute to make sure that we have a healthy environment. I just want to make sure that we live in a healthy, happy community.
So I focus on implementation science. It's like a gap between the research being done and when it's get implemented in the society. So I love to focus on that and health equity. And I'm a physician from India, so I also focus on the clinical aspect of epidemiology.
I'm actually starting my residency in psychiatry, so I would love to practice community psychiatry, raising awareness about mental health, and also contribute to community mental health programs in the community.
I hope to change the way that women and girls are viewed not only as potential future mothers but just as individual humans, really with full healthy life, whatever that means to them.
I think the biggest thing to improve in public health that I would like to pursue is really enhancing health equity and really making it a point to embed health equity, specifically more so equity in disaster management kind of standard protocols.
Maternal mortality rate among Black women. It's a passion project of mine. I wrote my thesis on it a little bit and would just like to create some change and keep women alive and mamas and babies and help the entire population.
I would love to help improve access to care, specifically mental health and behavioral health care, and just raising awareness about public health issues.
I really want to stay in Louisiana and have more equity here because public health touches everything. So it could be environmental, it could be nutrition. So I really want to make a difference kind of overall in public health.
I hope to help create equitable food systems in New Orleans and the United States.
Well, I'm going back home, which is in the Democratic Republic of Congo, and try to start new programs where I want to build awareness mostly about health. We have a lot of diabetes, hypertension. Those are things that need to be addressed, but they're not really properly addressed. So I want to start a program where I can help people understand the impact of health on their well-being and their everyday life.
I'm really looking forward to improving public health through technology and helping public health keep up with technological movement that's going on right now.
I'm hoping to provide access to resources for underprivileged populations and make sure that everyone has access to proper health care.
So I want to make sure that health equity is achievable regardless of race, social status, because we all deserve to be healthy.
Well, I'm actually already working in public health. I'm working for the Houston Health Department, so I'm planning to practice all the things I have learned here and make my job that is good. I'll be sure to make it great.
So I'm actually going to be working as a wellness coordinator for a local senior center in the town of Bridgewater, Massachusetts, my hometown. So I'm going to be able to support the senior citizens and provide wellness programs and make sure that they're living their best lives.
From now on, I'm going to be a healthcare consultant and providing a lot of support to hospitals around the country.
I hope to keep workers safe and use the education I got here to move my career forward and keep on helping occupational health.
I've been working with families affected by HIV in South Africa, which is the epicenter of the HIV epidemic globally. And so I'm planning to move to Cape Town and continue working there with community-based organizations that serve vulnerable children and families.
I'm hoping to do kind of more community-based work, and I study tropical medicine. I'm originally from Venezuela, and I'm interested in working with mosquito-spread diseases and other vector-spread diseases and kind of trying to work on the level of having interventions done at the community level and involving communities.
So I'm applying to medical school currently, so hopefully entering the class of 2024 next fall. And I want to do infectious disease, and so public health is very closely related to infectious disease practice, so hopefully doing that.
We've learned a lot about the inequities and social determinants of health, so just really focusing on that and helping those in need. So my work is basically around gender equality within global health organizations, and I advocate for diversity, equity, and inclusion within the health workforce, as well as promoting women's leadership within the health workforce.